Hello, everyone. Thank you for joining us. Today's Cancer Care virtual seminar topic is Cancer and Sexual Health 101 Part 2. My name is Carmen Boone, and I'm a outreach coordinator for the Samaritan Cancer Resource Center, and I'll be your host and moderator. This event is brought to you by the Samaritan Cancer Resource Center, with partner with anyone touched by cancer to provide the support they need to live with strength, determination, and hope into the future. Joining us today is Jessica Bell. She's with Samaritan Health Services. Jessica Bell is a physician assistant who provides gynecological care for adolescents and adult women. She's a Pacific Northwest native from Long Beach, Washington. When not serving patients, she enjoys spending time outdoors with her husband and 3 boys. They enjoy road trips, camping, skiing, hiking, and exploring together. Thank you so much for being here with us. I'll go ahead and pass the presentation over to you.
Well, thank you guys so much for being here. This is my presentation called Cancer and Sexual Health 101 Part 2. So Part 1 was a presentation that really laid the foundation for what's to come. And here we are now. So welcome. Again, I'm just so happy to be here with you guys. So today I plan on reviewing tissue changes, evaluation for these concerns, and treatments. We'll also talk about libido, which can be complex. It's definitely different for everybody. It evolves and changes over time. So the most important thing is really, that we talk about that actually, and we normalize that for that matter. And then it's actually important to, define what is sex and what is sex for you individually for that matter. How do we define it? And then when things change, how does your definition possibly change of that, and how might we work within that? We'll talk a little bit about expanding sexual repertoire, thinking outside the box, focusing on pleasure and not pressure. What I mean about that is oftentimes when, sex can be a lot of pressure for performance sometimes, for a specific outcome, and sometimes we actually lose the pleasure associated with the experience when we are pressured too much into those other things. We'll also talk about, a comprehensive approach to this kind of care. So mindfulness after cancer, pelvic floor physical therapy as an option, acupuncture, and even holistic pelvic bowl therapy. Okay, so just a quick review of anatomy. We did this together last time, but it's important to know these different spaces as I talk about them, right? So vulva is the external genitalia. The vagina is the internal vaginal canal. We have the urethra is where we urinate from. This is important because there can be some specific tissue changes here that happen with hormone changes and medications used to treat cancer. The clitoral glands is on the outside, but as we discussed last time, it is a very large internal and external organ. We'll also talk about the introitus, which is the entrance of the vagina right here, the entrance of the vaginal canal. This can sometimes get smaller with hormonal changes and with medications used to treat cancer. So that's a really important thing. So the introitus or vaginal opening. I'll do my best to not use the scientific terms that I use, and please, of course, let me know if you need any clarifications. So vulvovaginal tissue changes with cancer. What is happening? So tissue changes occur naturally over the lifetime when hormones change. Sometimes medications can affect this too, not just medications used to treat cancer. Medications that we've used in the past might have affected our tissues. Oral contraceptive pills can do that. If we've been on medications to kind of lower testosterone, it can do this as well. So, but most classically, we think of tissue changes happening with perimenopause and postmenopausally. What occurs as, from a scientific perspective, is decreased glycogen, production of lactobacilli, good bacteria, can cause a vaginal pH change actually. This makes the environment more alkaline, and people can start to get vaginal infections and bladder infections when these tissues become thin and start to lose estrogen if there's a pH change that goes along with it. Another thing that happens sometimes is the vulvovaginal architecture can change. So the labia on the vulva externally can sometimes become smaller. They can sometimes kind of fuse and absorb as well. This is something we don't know about our bodies, but it can happen. The clitoral hood, this happens regardless, I would say, of these hormonal changes, but something to mention. The clitoral hood, which protects the glands of the clitoris, can sometimes kind of cover the glands in its entirety, which can be problematic in that it can sometimes decrease sensation at this area, or the opposite can occur. If there's debris that's stuck under there, it can cause a persistent irritative sensation. And the entrance of the vagina, or the introitus, can become smaller. So as these tissues lose the glycogen content, they literally will become stiff and more rigid. And in doing so, they can become smaller. So where a woman might have had a fairly, not necessarily a large entrance to the vagina, but, an adequate entrance to the vagina, previously, with hormonal changes and with medications used to treat cancer, radiation, a lot of other things can cause the entrance of the vagina to get smaller. So this is a constellation of symptoms called genitourinary syndrome of menopause. So for one thing, I just want to show up for is a lot of the times people think that thin tissues related to menopause are only bothersome if a person is intimate or if they are sexually active. But indeed, that is not the case. So these really thin, dry tissues can cause this whole constellation of symptoms, which include vulvovaginal dryness, burning, itching, irritation, pain with intimacy, bladder symptoms of pain with urination, urgency, frequency, incontinence, recurrent urinary tract infections, or vaginitis infections. Indeed, it can be so uncomfortable that some people might actually have a very intense bladder pain from these thin tissues, and also I would say sometimes these medications used to treat cancer, and sometimes ladies will undergo cystoscopy or evaluation of the bladder with the assumption that there might be some pathology or concern there, when in fact it was likely the overlaying organ, the tissue organ, that was causing a lot of this irritation to begin with. And then when we treat that tissue organ, the bladder calms down. That's also in part due to kind of a myofascial response, tension in the pelvis and in the muscles from those irritated thin tissues. So as you can see, this is not just related to sex or intimacy specifically. And for many, these symptoms are intolerable and can lead to quality of life issues. So evaluation and treatment. First, a thorough history is so important. I need to figure out, what symptoms were you having before your cancer treatment, and how have they changed? And then what are your goals? Where are things uncomfortable? What are we really working on here? And this is why the physical exam is vital. So this can help direct an individualized treatment approach. And typically that's all we need. We don't often need kind of more invasive or possibly expensive evaluations to see what's going on. And when I say an individualized approach, that's definitely the way I treat patients. So I need to, again, where is your discomfort and what are your issues and how can we resolve that? And this is why treatment really depends on the physical exam findings and the individual goals of the patient. Not everyone's goals are the same, right? And so their treatment doesn't need to be the same either. This is definitely not a cookie cutter kind of situation. So if treatment is individualized, how can we talk about it in general? Well, like I say, I'll do my best, right? So first and foremost, really having an understanding of these tissue changes, body changes, and what's happening in your body is so powerful. To just know how our bodies evolve over time in general, and then again, how they change when we undergo these treatments. If you have an intimate partner in your life, it's also important to communicate with them what's happening with your body. they should know this information too, so that they can understand this better and be a support to you. So there are non-hormonal, hormonal, and behavioral recommendations that all play a role in this comprehensive approach. So I know a lot of you guys have been excited, I think, for this part, which is the vulvovaginal dryness. What kind of non-hormonal options are there? So natural oils like coconut oil were recommended in the past. This might still be an option. However, we do have some studies that show there might be a concern for increased vaginal infections when using coconut oil. So if you're somebody that uses coconut oil, but you're always getting a yeast infection, that's probably not the one for you. I wrote down a list of other options here. None of these are better than one another necessarily. Some of them have data behind them. Halogen is a hyaluronic acid gel that's inserted inside the vagina. We do have some data that shows that that can help with the symptom of vaginal dryness in itself. This, however, may not address the pH change specifically. So if a person is really having recurrent urinary tract infections or vaginitis infections due to thin vaginal wall tissues, then that's actually when we need to have possibly a serious conversation of hormonal options, actually, vaginal estrogen, which can be safe to use in cancer patients for sure. But these are my non-hormonal options. So Reverie is another hyaluronic acid suppository. It's inserted inside the vagina. It's a bit spendy. I don't have the cost on all of these. Halogen is not a suppository. It's kind of a gel. Via has hyaluronic acid, vitamins. Rosebud Woman is a brand name. They have 2 creams. Well, I think more than 2, but one of them is Honor and their Soothe cream. That's more of a vulvar moisturizer. Kendra is a daily lotion with a coconut oil, sunflower oil, and vitamin E. It comes with like a little egg applicator, and so you can put this cream on this little egg-shaped applicator, which just sits in the entrance of the vagina, and that's kind of a handy way to apply it. V Magic is a mixture of oil, honey, and beeswax. Relevium is a skincare repair cream with lidocaine and aloe in it. Some people don't respond well to lidocaine though. And then CBD topicals can be helpful too. There are some brand names out there. And then actually locally here in Oregon, for sure, there's some options as well. And then honestly, some of the moisturizers that you might have on hand at home already. A lot of those are gentle enough for the vulva, but you should not use anything fragranced. But some of the like Cetaphil or CeraVe or Eucerin creams could be used on the vulva. Also, when it comes to some of these vulvar moisturizers, to each their own on cost point, right? So, I mean, you might get the same result from a $3 cream as you do from a $40 cream. Just like somebody might spend, you know, $3 on their face lotion, some other person might spend hundreds of dollars on their face lotion. So, not one, in my opinion, is necessarily better than another based on cost alone. It's really, you know, what you like and what your preference is and how your individual body responds to this. Lubricants. Oh my gosh, this is a huge one. We need to know this from the very start of intimacy. So all the lube all the time, really, truly. We have studies that show that lube increases pleasure, and it can increase a rate of climax, again, because things feel good, right? So if we're having pain and discomfort with intercourse, it's easy to be distracted, and it's painful, and so it's also something that we typically would want to avoid, right? So not all lubes are created equal, though. I like to geek out on this stuff a little bit, and so there is some osmolality differences. This is a chemistry thing. So some lubricants might work well in the moment, but then kind of the way they're made up, they might actually draw some of the moisture out of the vaginal walls down the line. So a few that I know are good is Uberlube. It is a silicone-based lubricant. A little goes a long way is the take-home message there, really, truly. Sometimes it can almost be too slippery. Some people use that as a vulvar moisturizer as well, so it can have more than one application. Slippery Stuff is a water-based lubricant. It's just an extra special water-based lubricant. It's actually made up in Washington State. Good Clean Love has multiple lubricants. They're a local company in Eugene, Oregon, actually. And I went ahead, since they have this handy little osmolality thing, I attached that down below here. As you can see, KY, and not so much. If, however, you found a lube that works for you, right, and you've had no issues, then definitely keep using it. Just because I say that there's some data that shows that it might do this, again, if that hasn't been your experience, just use what you got. But all the lube all the time, no lube shame. Even when tissues have good estrogen effect, we do need lubrication, and vaginal lubrication can be complex. So a lot of the times, again, we're kind of told these different stories. There's different messages that occur for us, and one of them is that if we have enough arousal, then there should be enough vaginal lubrication to go along with that. And that's actually not the way it works. Again, I like to geek out on this stuff, but vaginal lubrication is a transudit, not an exudit, and so you really have to be well hydrated. People that are on medications that might dry them out, might actually dry out the vaginal wall canals as well. So again, you might have a lot of desire for an intimate experience and just simply not have the vaginal lubrication to go along with it. That doesn't mean that you are lacking desire. It doesn't mean that your body, anything is wrong with your body. It just means that you need to use lubrication. So this is important too, right? What is sex? Again, all sorts of messages and familiar stories here, but the familiar story of sex is that it's penetrative intercourse between a man and a woman, typically ending with male orgasm, right? One of the women in my field said, the only person that has vaginal orgasms are men. And this is that reality that I brought home at our first presentation, which is about 80% of women do not experience climax with penis and vagina intercourse alone. That you do need purposeful stimulation of the clitoris often to experience climax. So everybody is different and works differently. This is vitally important. And I think I probably mentioned this last time, but as individuals, it is best to get to know our body so that we can share that information with a partner. I know that there's some barriers to this, sometimes cultural, religious, that kind of thing, but truly, understanding your own body, how it works, is the only way to then discuss this with a partner. And this is also important when our bodies change over the time as well. Again, when our tissues change or we've undergone treatments that might affect sexual function, sometimes we need to take a step back and understand our body again. And that's that next part here. So understand that bodies change. This is a normal process, but it can be impactful, right? So if your body doesn't work the way it worked before and everything changes, you can't be intimate the way you were before, then it doesn't mean that there are no options. So when bodies change, intimacy can change. Sex can become painful, erectile dysfunction can occur, and then sex, quote, can come to an end. However, if we recognize the wide variety of activities that are sex, we can expand our sexual repertoire and continue to experience pleasure even when those body changes occur. For one, there's a lot of erogenous zones, right? So, and it's not all in the pelvis. One way to discover this is to, again, explore this for yourself, be mindful, do this in a quiet and judgment-free space where you get to understand your body on your own. Another way to do this with a partner is with what we call sensate focus. Sometimes it's also called mutual massage. I went ahead and added the website here, but this is a way to improve communication. It kind of allows you to take a step back and rediscover things. And again, when our bodies change and we can't be intimate in the way that we were before, sometimes that's actually an opportunity to consider how we can expand our sexual repertoire. Vibrators or stimulators are definitely teammates. They're not competitors, right? Again, if we honor the way the female sexual organ, the clitoris, works, it needs purposeful stimulation for that to occur, which doesn't happen always with penetrative intercourse. And so sometimes adding a vibrator into even partnered intimacy can be quite helpful. Sometimes people's, again, bodies work completely differently and they can't participate in penetrative intercourse at all anymore. And then we might start discussing things like mutual masturbation. That's where you're intimate together next to one another. So it's still a partnered experience, but again, it's a way to still be intimate with one another, but in a different way, possibly. Sometimes we can expand our sexual repertoire by considering hobbies that we're already, interested in, and then, kind of repurposing those into an intimate way. So if you like to paint or you're into art, again, that can be kind of a sensory play. You can do a lot of different stuff with that. There's some beautiful rope tying. There's a lot of things to do. That's almost a whole talk in and of itself. So libido, definitely complex, right? Desire is unique to each individual to start with, and we kind of set ourselves up for failure by comparing ourselves to others. Desire differences are normal, they're common, and they definitely change over time, right? I mean, we're not the same people when we're 20 years old, 30, 40, 50, 60, 70, 80. So let's allow ourselves to change. Let's allow our desire to change as well. It's normal to fluctuate, like I say, also with life experiences. So again, treatments with cancer, right? These different things that happen to us in our body. It is normal for your libido and your desire for intimacy to change with that. And it's okay for you to just be okay with that, for that matter, for this time in your life to be okay with where you're at, right? It's also, though, okay to want to improve it. We can be accepting of this, but still want, right? So this is where these personalized conversations come in handy. Again, though, just in general, desire discrepancies are common. Meeting somewhere in the middle can be helpful. Showing up for this conversation, determining boundaries and communicating that. I've talked about, when we decline somebody's advances, to possibly give them a reason as to why, gosh, I just really want to read my book right now, or I've had a really long day, I love you, or I like you very much, but this is just not what I need right now. That feels less like rejection. Also having an understanding of an overgeneralization, I would say a little bit of male versus female sexual desire, in that male desire is often more spontaneous. It is sometimes more directed or related directly to genital arousal, genital response, whereas women's desire is often more receptive. So that happens more in context, right? So for women, sometimes you really need to have, a lot of context. Things need to be done maybe around the house. You can't be tired. All of those different things in order to have some desire for an intimate experience. Otherwise, again, distractions, a lot of things can come up and it's not a pleasurable experience. So if there are desire discrepancies, making a plan and planning for intercourse is very, very helpful. Be careful, though, not to commit to duty sex. So again, this is a more deep conversation probably, but planning for intimacy is so important. We've got big schedules sometimes that take up our time, and if this is an important part to keep connection with a partner, then it is okay to say, hey, Saturday mornings, Wednesday nights, whatever it is, right? However, make sure that this is not something that you are dreading or not looking forward to, okay? That turns into what we call duty sex, and that can actually start to be resentful. And also to bring up, it's common to not want sex you don't want, right? So if you were served the same meal every day, you would want some variety. It can be, you can eat at the same restaurant for sure, but it is also okay to ask that they expand the menu, okay, that you do something different. Also, admittedly, if intimacy is painful and not pleasurable, that's not something that we're going to want to desire, right? So sometimes we need to also, for that matter, expand what we consider sex and intimacy to be, especially when our bodies are changing over the time. So mindfulness and mindful after cancer, this is a big deal, and we've got a wonderful resource here in Corvallis, Oregon. Jessica Gorman recently did a study on implementing mindfulness-based practice specific to cancer. This is not implemented in any specific location yet, but she's here with us, and I hope that we can kind of keep some momentum going with this. Her study found that cancer survivors experience sexual dysfunction and related distress after diagnosis and well after treatment ends, yet there are few interventions available. So improved access to effective interventions can improve the delivery of survivorship care and patient outcomes. And oh my goodness, isn't this true? So stay tuned. Hopefully we will, the other Jessica and I will work on this together in the future. Dr. Lori Brado's book is one that you can obtain now. It's called Better Sex Through Mindfulness. She was recently interviewed on the Netflix documentary Principles of Pleasure. She is amazing. And then in general in Corvallis, we hope to work towards workshops and other offerings that include mindfulness practice. There are mindfulness coaches locally that you can work with one-on-one and virtually as well. So comprehensive care, this is just a little spattering of some other things. I mean, pelvic floor physical therapy, huge, huge. It can give you a better understanding of your body. It's so helpful. Acupuncture, there's a person in town who does a holistic pelvic bowl work. She had some pelvic floor dysfunction and did some training on how to address that from a holistic perspective. Massage, outdoor therapy, you know, just kind of taking care of yourself really and truly is helpful for a lot of these things. Oh, the laser. I didn't mention the laser yet. So you might have heard of the laser for vaginal dryness related to cancer or just vaginal dryness in general. There is a laser procedure that we do not do through Samaritan. It has kind of limited success, I would say. It may improve some vaginal dryness. It's not covered under insurance. It's quite expensive, but it does exist. And just addressing specific problems. I would love to see any of you to, you know, take a thorough history, get this conversation. All right, well, thank you so much for being here today. It was great to do part 2 with you, and I look forward to continuing to work with the Cancer Center. All right, all done. Thank you guys.
Thank you so much, Jessica. It's been great, and I just want to let you know, the audience, Jessica Bell, she's a physician assistant. You're gynecology and female sexual medicine. She's a doctor from Samaritan Health, so you can find her here. So now I'm gonna give our participants, audience, a few moments to write any questions and comments in the questions bar. And while you are entering your questions, I'll go over some contact information and upcoming events. If you would like to obtain more information or resources about cancer, feel free to contact the Cancer Resource Center by phone, email, or visit our website. If you're interested in upcoming events, please contact us or subscribe to our Cancer Resource Center newsletter. And these are the events that are coming up in September. We have Managing Side Effects of Cancer Treatment on Monday, September 12th, and Metastatic Prostate Cancer on Thursday, September 15th. Our webinars are from noon to 1. And if you're interested in joining Cancer Care Virtual Seminar, email us or call us. And now let's go over any questions. Let's see. Well, I think our audience have learned a lot today, and everything was pretty clear and awesomely well explained. So I don't see any questions. But remember, if you have any questions, for our guests that you would prefer to be answered privately, please email us at cancerresourcecenter@samehealth.org, and we'll be happy to connect you with Jessica so you can get your questions answered. And thanks so much again. One last request, please fill in the survey that will open after the webinar has concluded. Thanks so much to our speaker for sharing her time and knowledge with us. And finally, thanks to all for participating today, and you may disconnect. Have a great day, everyone. Thanks, Jessica.
Thank you, guys. See
Goodbye.
you next time.
It's been fantastic. Bye.